Right, well, welcome everyone. Good to see so many of you here today. I know we're joined today by a mix of CareLineLive customers as well as people that are just interested in either CareLineLive or MOA benchmarking. So welcome to all of you. We are not going to open the mic to everyone because there's just too many people, but if you have any questions at any point, please just pop them into the chat thread. It's easier in the chat thread than the Q&A thread. They get missed occasionally in Q&A. So feel free to put them in there, and we may well interrupt the person that's speaking, or we'll come to that question a little later on. But anyway, what today's meeting is about is introducing you to MOA benchmarking, really. This is about making compliance an integral part of everyday care. I know that some of you have probably had demos of MOA before, thinking, is this worth adding to my software package? If you're with CareLineLive, it's part of the renewed subscription now. Well, some elements of MOA anyway, and Dave will talk about that. So rather than me rambling on about that, let me just give you some proper introductions. I'm Marie Page, I'm the head of marketing at CareLineLive. I'm joined by David Sanders, who's the Chief Operating Officer at MOA Benchmarking, and also Katie Latham. So Katie is from Choices HomeCare. Choices have been a customer of CareLineLive for quite a long time now, and they have also worked with MOA for a while. We've done a lovely case study, an interview I did with Katie a few weeks ago about how she's found MOA. So we'll share a link to that in due course and with the email that we're following up. But we thought we'd actually have Katie so you can hear her talking about it and how they have found MOA. We will be recording this webinar, and we will be sending you the copy of the recordings. So it won't be immediately afterwards because we tend to just like to edit it, take the top and then, top and tail it basically. And then we send out a YouTube link. So if you're new to CareLineLive, just a quick update on what CareLineLive is. We're an all-in-one home care management platform. So we have around 700 agencies working with us, mainly in the UK, but we are increasingly growing into Australia, New Zealand, and various other territories. Our Australian development it takes place over there. So your UK development is done in the UK now, and by a UK-based team. So the platform is really comprehensive, and even if you take an hour's one-to-one demo with us, you're not going to go to everything in loads and loads of detail, which is why we do some of these webinars. So we include rostering, scheduling, care planning, care monitoring, EMAR, payroll, invoicing, 3 different platforms. There's the management platform, there's the Care Circle, which is for friends and family, and there's also the Carer Companion app for carers. So we've jumped through a lot of hoops to get the accreditation to be an NHS England assured supplier of digital social care records. That is such a mouthful, isn't it? But that means that you get a certain level of functionality guaranteed with us, and also of security as well. And the bar on that raises every year. So we are continuing to develop based on what NHS England is looking for. And as mentioned, subscription to CareLineLive now includes compliance tool MOA. So you get 2 of the sort of core modules from MOA as part of that, and additional modules are available at a very low cost as well. So MOA is particularly useful for providers that are working with CQC and CIW. So that's the CQC equivalent in Wales. Dave will go through a little bit more detail, of course, on how that all works. So what I'd say about CareLineLive is we are the highest rated home care software company on Trustpilot in the UK. We have a 4.8 star rating, so we're the only one that's actually rated as excellent. We've got a number of new features coming up. Got some webinars due very soon on some of those features. So for instance, body maps and forms in the Carer app, which is something we were chatting to Katie about just now. She's really looking forward to that. We've got PRN coming in, and all sorts of other good stuff coming up. So lots of new features coming up. And the final thing to say is that when you buy CareLineLive, you get the whole system. So you don't pay extra for other bits of functionality. You do also get these 2 sort of core modules from MOA as well. We don't charge anything for office-based workers, so you pay for the number of carers that you have, and as many office-based workers as you like, free of charge. So I'm going to hand over to Dave, who will talk about MOA, Let me know if you need me to move the slide on, Dave.
Thank you, Marie, and good afternoon, everybody. It's very nice of you all to take some time out of your day to come and have a chat to us and hear what we're about. So, as Marie's mentioned, I'm Dave. I'm the COO at MOA Benchmarking. MOA has been operating in the UK for about 4 or 5 years now as a compliance and continuous improvement solution. We've had a relationship with CareLineLive as well as a few other platforms throughout that time, but we're working much more closely with CareLineLive in particular now. And as mentioned, the MOA product is now becoming much more embedded within the CareLineLive ecosystem, both in terms of the way that it's bundled into contracts for users of the CareLineLive system, and also in time over the coming weeks and months will be more and more embedded from a product and technical perspective as well, with some tighter integrations beginning to happen and data flowing between the two systems. The company itself, just to give a little bit of background and context on where we're coming from, has been around for about 20, 25 years now. We got our start in Australia, despite what it might sound like in my accent, though the company is, the UK operations are all based and run out of the UK. And we've been in that jurisdiction, though, working with quite a large number of providers for a long period of time now. We work with a little bit over half of the sector there, and we're rapidly starting to grow and bring on more and more providers in the UK space as well. The product offers quite a range of different modules and different pieces of functionality that we'll discuss at different points today. But the main focus, in keeping with the theme of today's session, is around the compliance and auditing and continuous improvement tools that we have. So, Marie, if you wanted to perhaps just bump over to the next slide and we can take a look at the high-level diagram that we have here. So on this kind of paler tile in the middle of the slide that Marie's got here, on the left-hand side, these self-assessment tools are the things that we provide as part of the included package for all CareLineLive clients within our compliance and continuous improvement piece. The most significant element of those will be the audit tools. So we have a suite of tools that we review on a continuous basis and update as legislation and standards and best practice guidelines and things of that nature change. That's particularly prevalent at the moment, of course, as there's much discussion within the CQC around revising the single assessment framework, or even working to kind of phase it out entirely and replace it with a set of standards and a assessment and inspection framework, which is a little bit more clearly articulated and a little bit easier for providers to demonstrate compliance with and align with. But as all of that work goes on, our team work to revise the tools that we make available within the system to make sure that that's all reflected in what we're doing. So those audit tools, they're made available through our web application. They're released in monthly batches, and they provide a comprehensive self-assessment of your performance and of your compliance with the single assessment framework for CQC, and with the CIW standards for any providers that have a footprint in Wales as well. Those audits get a good cut across all of the different elements of your operation in terms of what we look at with those tools. So we look at policy and procedures and how robust and well equipped and aligned they are with what's required of you of the standards, and how well placed you are to demonstrate that those are suitable. We also look at gathering practical and operational evidence through those tools. So there's components of reviewing of care plans, reviewing of other documentation, staff knowledge, interviews, those sorts of things as well. The outcomes from all of those reports are given to you in real time, so that you're able to get a really good insight into what your performance is like with regards to your CQC compliance every month as your audits are completed. And they're also benchmarked against other comparable providers. So part of what we do with our team at MOA is that we work on approaches for getting an understanding of industry level performance across all of the different areas that our tools assess. That's underpinned by the work of our in-house epidemiologist and a team of data scientists that work with him to make sure that the reporting tools themselves and the methodology that we employ for giving indications of that performance and for estimating what broader industry performance is like in those areas is suitable and robust and tailored for each individual provider. We'll take a look at a little bit more of how that works a bit later on in today's session when we go through sort of the functional demo of the system. But all of that also flows through into the continuous improvement planning tools. So obviously it's one thing to have in place all of those systems and tools for conducting your self-assessment and looking at what your compliance is like. It's another thing entirely to be able to demonstrate that you're doing something useful with that information. So the continuous improvement module will allow you to respond to and plan and log all of your corrective actions or continuous improvement initiatives that you're undertaking based on the data that's coming out of the various different audit tools and survey tools. And it will also allow you to, again, demonstrate that that's being done. So you'll have dashboard reporting that you can bring up to demonstrate, say, inspections for CQC or for CIW, so that you can show how all of that self-assessment data is flowing through to improvement actions and improvements in quality of care and service that you're providing. Off to one side with all of that as well, we've got various different other ancillary modules which are more tangentially related to compliance rather than being directly in that space. But they're all things that providers have an obligation from a compliance perspective to have in place. And they're things that you're able to address and handle quite elegantly and frankly quite cost effectively within the MOA product as well. So that's things like our feedback and complaints module, our incident management module, and our risk management and risk assessment tools that are available within the system as well. We probably won't look at those in as much depth of detail today, being as the focus of today's session is kind of on the core compliance and how the workflows within our tool can embed that into your day-to-day practice rather than making it a big monster of the project that you have to deal with less frequently. But they're all interrelated, all interconnected with the other tools, and we're always happy to chat to people about those as well. So hopefully that gives a bit of an overview of kind of who we are and what we do and where we're coming from. Marie, I'll hand back to you at this point, and I'll speak to you all again quite shortly when we jump in and we have an actual functional demonstration of how that all looks as well.
Sure, no, that sounds good. So what we'd like to do now, if that's okay, is introduce you to Katie. So Katie, do you want to unmute yourself as well?
Hello.
Lovely. Right. So Katie is the quality improvement manager. So she does this stuff full time, basically, for Choices HomeCare. There's a link there to her case study, the interview that we did with her before. So we'll send that out to you in the email. So Choices operates 14 dom care services across the northwest of Yorkshire. There's a mix of local authority and private clients. They're delivering up to 400 hours of care per week to larger services, delivering close to 1,000 hours. So this is what Katie said when I interviewed her. So I want to read this out. I'd never used MOA before, but the training and support were great. Spent a lot of time working through it properly, and once I understood the reasoning behind it, it made complete sense. The reports do the analysis for you. That's the biggest win. Instead of spending time working out what the findings are, you can spend that time actually acting on them. And I think from someone that does this full time, that says a lot, doesn't it? Because, you know, in theory, Katie's got the time to do this because this is her job. And I know for a lot of you, this will be an element of a much, much broader scope of work. But the reports are doing that element for you. Before systems like this, audits would fall behind simply because there wasn't time. MOA benchmarking has easily cut that workload in half. Katie, do you want to elaborate on that in terms of cutting the workload in half?
Yeah, so obviously prior to rolling MOA out and implementing it further into our services, we had tons of different systems, trackers, you know, lots of different basically things that we were trying to keep track of the governance of the audits and compliance in general. So it was hard for people to basically keep on top of it because things were just in lots and lots of different places. So having it all in one place has been a huge help, not only to myself for my oversight, but for the service managers as well, to be able to have everything they need in one place so they can keep on top of their own compliance and audit completion, etc. So that's where the time cutting has come into the fact, which has been great. So
that's wonderful. So maybe just give us a bit of a scope as to what a quality improvement manager does.
Yeah, so obviously I improve quality. So obviously within my services, I obviously support the teams in, improving systems, processes, qualities of works. I improve the care planning process. Obviously, there's a lot about CareLineLive that I kind of know that I've cascaded down to the team, so they obviously utilise the system a lot better. Obviously ensuring that audits are completed, finding easier ways basically for them to keep on top of compliance. So yeah, just a general support and to ensure that the CQC ready basically.
That's great. And speaking of CQC, what is your current rating?
So all of our services are currently good. We have a lot of them have been our acquisitions, so we haven't had inspections under Choices at the moment, but I'm sure that they're on their way. But we're confident going into those inspections. MOA plays a big part in that. It allows us to be able to evidence the audits that we're completing, the feedback as well, because we're obviously heavily embedding the survey part of MOA now. And obviously evidencing our improvements that we're making. So it's helping us move towards being inspection ready rather than reacting when an inspection is announced, as we all kind of do anyway.
And I guess an obvious question from people that are already with CareLineLive is like, what does CareLineLive not do that MOA does do or does in more depth?
I think obviously more, they both have their own specific benefits. MOA to me has always is the oversight of audits and survey feedback, that sort of thing. That's what we've kind of utilised the service for mainly. Obviously we're the care planning and tracking compliance, staff compliance reviews, things like that within CareLineLive, and being able to pull reports off there is obviously that side of it. But MOA gives us the audit compliance side of it, and they marry up basically because both systems kind of reflect one another, so they work together.
Great. And I'm sure you're looking forward to more deeper integration between the two. Absolutely.
Yeah, no, 100%.
I should just add that if people are confused by the Optimo logo in your screen, Optimo is the parent company.
Yeah, so well, it's the umbrella company. So Optimo Group is our umbrella. We have supported living and specialist services under the umbrella, but we're the Choices domiciliary care side.
Right. We ought to say as well that MOA does work in the residential supported living sectors as well. Although with CareLineLive, although we do some supported living, we tend to focus on dom care. So if you were to highlight two key benefits or takeaways from you using MOA so far, what would they be?
So I'd say for me, the two key benefits that I've had are firstly the ability to create the custom audits, so being able to take our own audits that we were previously doing on paper or other systems trackers and bring everything into one system. So it's obviously improved consistency and tracking alongside obviously the domain audits that are already in place with MOA, so they kind of complement one another. And then I'd probably say secondly, the level of oversight, not just for the services as well, to be able to see their individual service oversight, but for me as a more senior management, to be able to oversee all of my services in one place, pull off those reports and the information, so I can help create action plans, support the services to proactively ensure that they're completing the audits that are required. So yeah, that's been a big game changer for me.
And when you've had CQC visits, have they kind of seen your use of MOA? Have they had any feedback on it?
So we haven't had anybody yet,
okay,
but we have had local authority, PAMS assessments, things like that across our services, who have been impressed. They found the system really easy to navigate when I've showed them, and have been able to show what our oversight is and kind of how we're keeping track of action planning and all of those things, and obviously the survey side of it, being able to generate the feedback, so that's been really helpful. Yeah.
So I just realised I was still showing my big screen rather than people being able to see you fully, so apologies for that. That's useful. So I'm going to just open, if anyone has any specific questions for Katie that you want to raise now, please pop them in the chat thread, and there will be an opportunity to ask questions a little later. So Katie, you presumably recommend MOA to other care providers that are manager compliance. Anything that you haven't said that will kind of, answer the question why on that?
Not only obviously from the things we've already discussed, the impact that it's made, but also obviously the system's really user friendly. So I'm quite good with technology, but I do have some of my managers who aren't great with technology, but they find it really, really simple to use. The support from the team is great. So obviously I have the MOA rep Aisha, who has been wonderful, and even though I've admired her so much, she's been really great. She responds really quickly, and obviously any changes or adaptations I want to make, as she's got onto them straight away, so that's been great. Most importantly though, it gives you a really strong inspection ready way of evidencing your compliance and your audits and the feedback, which takes a lot of pressure off. So
thank you. That's really good to know. So before we move back to Dave, I wanted to just, and we've ambushed Katie a little on this, we discovered that Katie had a Just Giving page up for her little boy who has cerebral palsy, and you're currently in a house, aren't you? And you are needing to move desperately to a bungalow so that you can have a hoist in there and just save some of your own body and back in the lifting and everything of him. Who was it that you said had shared this recently?
So Jason Manford, the comedian, he does a page called Charity Ninjas, and they kind of it's basically members of the community that follow it, and they all put a small donation, with that being £2, as the normal donation, as you can see on that top one. And they don't leave their name, they leave a little ninja symbol to kind of make it a bit mysterious. So he kind of randomly chooses a page and advertises it and encourages people to help. And when he did that, I'd only recently put this together to try and, because it was my only option at that point, and he advertised it, and that's where it is, and it's ended up where it is for that. So I'm massively grateful. So.
Well, we will look to see if we can make a donation as a thank you for your involvement with this. So thank you for that. Let's go back to Dave now. Do stay with us, Katie, because we have some questions for you later. Oh, there is actually a question. Okay. Janet says, oh no, this will be more of a question for Dave. So
no problem.
Janet would like to know if there's a limit to the number of audits you can have on MOA.
Yeah, there are not. So with the product off the shelf, as it were, we give you a suite of audits which will comprehensively conduct that self-assessment against what's required of the standards. But then you can add your own custom tools into that to your heart's content. So we see that very commonly with things like operational checklists, environmental checklists, all sorts of stuff like that can be loaded into the system as custom tools as well. And as part of the onboarding process, we'll usually work with you to conduct an assessment of the tools that you're currently using or whatever systems you've got in place at the minute. Kind of do the Venn diagram, if you like, between that and what we can provide in the MOA library. And then we'll come up with whatever solution gives you the best coverage across all of the things that you need to do between your own tools and the ones that come as standard with MOA.
Thank you. That's the only question so far. So do you want to share your screen and go ahead with your demo?
I can do, yes. Bear with me 1 second while I just grab that up. I just wanted to, just while I'm grabbing that up as well, we had a question that we asked of Katie earlier around CQC inspections that she's had since putting MOA in. And I do know that we have had, aside from Optimo and Choices, we've had a number of other providers that have brought the MOA platform in post an assessment. So we've had a number of providers that have had an inspection conducted and have come back with a requires improvement from the CQC, who have implemented the system, run it for 12 months or so, and then had kind of re-inspection, because of course if you come back with a requires improvement on your inspection, you get reassessed quite quickly in a lot of cases. We've had a number of providers that have implemented us, run the program for a year, 18 months, had re-inspection and have gone from requires improvement straight to good, or one of them's gone straight to outstanding as well, I believe. And in the reports, in the inspection reports that have been published by the CQC for those guys, the system, i.e. MOA, that they've incorporated gets called out in those reports as well, for commercial reasons, and because CQC, being government, doesn't like to make our lives too easy. They're not allowed to call us out by name in those reports, but they talk about the robust auditing and self-assessment software that's been incorporated at those providers. We've got a number of cases where we've seen demonstrated improvement in compliance outcomes, and by association in care outcomes, of course, for providers that have implemented the system. So what we'll do now is we'll jump in and we'll take just a really quick look at the system itself and a bit of a functional overview of what we do. The demonstration environment that I've got here is very extensive in terms of the individual modules. So what we're looking at here is an example of a very senior user at a demonstration organization who, aside from the compliance and the self-assessment audits and the like, has things like risk management and incident management and feedback and complaints tasks. So for this particular user, quite a bit jumps out at the screen when they first log in, but particularly if you're a smaller provider or if you're only using the auditing and self-assessment components themselves, this section through the middle here is the one that's going to be most relevant to you when you first log in. So this gives you an overview of the various different service locations, so CQC registered locations that you've got configured in the system. A lot of people in the dom care and the home care space just run the one, but if you've got different regions or different counties or things like that that you're operating, which perhaps have different operational teams or are subject to separate assessments, you'd set those up in parallel. If we jump in and we have a look at one of our test services here, we're able to see the tools that are made available for those locations and for those services in the various months. Now, all of those tools will be for this environment as per the standard schedule that we provide for, in this case, home care or dom care or social care providers. So this is the content that we offer off the shelf, as it were, within the MOA products. These are the audits that our team of people who've worked at the Commission and worked at other regulatory bodies, people who've worked in quality and compliance roles at care providers, and other academics and clinicians and people of that sort of background. That team worked together to put all of these tools together and review them on a continuous basis. So this is the content that we provide on that default schedule. That's all customizable around exactly what it is that you need to assess based on how you operate and what is and isn't in scope for you, of course. So particularly these specialist audits here, where we're looking around things like medications and meals and nutrition and restrictive practice. For home care providers and people that are providing care in the community as distinct from care homes, a lot of that content will potentially not be applicable because, of course, it's such a diverse space. So that gets customized around what you want to do, along with the other audits. So if you want to, depending on how resource limited you may be, you can span this over 2 years instead, or you could run some audits more frequently, all sorts of things like that. But in general, this is the principle that applies. So we start with this, we tweak it so that the content is relevant to what it is that you need to assess. We incorporate any of your own internal checklists and assessments that you want included in the platform as well, and they'll pop up on the schedule too. I should also mention, incidentally, too, if any of you are working for organisations that also operate care homes or other residential aged care or social care facilities, we have programs available for those as well. So, of course, for the CareLineLive customers, that being operating in the home care and domiciliary care space, the program is aligned specifically with that sector. But anybody who's operating care homes and potentially won't be using the CareLineLive product in that space, we can also provide suites of tools and assessment platforms in that sector as well. So you can extend it beyond just those services. But whatever tools you've got scheduled in you from each individual month, those will be provided for you on the monthly schedule here. So a user that logs in can see what's available, how much of the data has been entered, and how long they've got left on their deadline before they complete it. And then when we jump into the individual audits, these are all broken up into a range of different parts. So there's a policy and procedure review, or structure and policies, which is the first component of these audits. This would typically be completed for larger providers in particular, once at kind of a head office or governance or quality team kind of level centrally, rather than each location completing them individually. If you're smaller service, single location, of course, you just complete it as part of that entity. But this is kind of the higher level, establishing policies and procedures are suitably robust, making sure you've got appropriate systems in place, that kind of thing as well. All of those questions, aside from the question that's aside from the questions themselves, they've got some explanatory, more information icons here as well. So this particular audit, of course, focuses on falls. And one of the questions we're asking is about whether or not we're reporting falls to relevant health professionals. So in this example, what constitutes relevant health professionals, who we should be considering that reporting to, all that type of stuff is outlined for you within the explanation fields here as well. That particularly comes into its own with the way that the single assessment framework in particular, and the assessment frameworks in Wales to a lesser extent, designed. So the what's required of you under those standards is generally at a very high level made quite clear within the frameworks themselves and within the standards, but then not very detailed at all in terms of how that should look and present within services. So what sorts of evidence you should be able to provide, what it should look like when it's being done effectively. So that's a key part of what we offer, is not just a checklist of those requirements, but discuss how you should be implementing that and operationalizing that within your services. Against individual requirements for the standards and the quality statements for the assessment framework as well, and we'll leverage that for reporting down the line. But as far as the data entry process is concerned, that's kind of all there is to it. So we rinse and repeat that same mechanism for each of these different components or parts of the audit, which are just casting different lenses over different areas of quality. So reflective questions would be completed by somebody in a management capacity. So still focusing on your systems and processes, but less around, you know, diving into your policies and procedures, and more just generally how confident do we feel in demonstrating that we were compliant with each of these areas if we had an assessment tomorrow. And then we do some collection of other random sampling data and other kind of practical evidence of compliance. So this is where we utilize components of the audits around interviews and staff practice. Interview components are effectively some very high-level staff knowledge assessments, not intended to be deep dives or competency assessments or to cover any of the things that your education and training tools or systems or that kind of thing would do. This is just at a very high level. Do your staff have the knowledge and understanding that they should have to be able to operate effectively and safely in this area of focus? So what are the sorts of things that the CQC would expect you to be able to demonstrate, or your staff to be able to demonstrate at inspection? And are you confident that your staff can do that? And then similarly, we collect evidence from care plans and from your clients and from other systems as well. That's usually captured in a component that we call staff practice. And this will be taking a random sample of, again, as this is a falls audit, we're looking at clients that have a risk of falls or a history of falls, and we're reviewing the care planning and documentation that we have in place for them. This is one of the key areas where we're really excited in the coming sort of month. It's not quite there yet, but in the coming months to be able to flesh out the integration that we have with the CareLineLive system to be able to really streamline the collection of this data. So being able to tell us you know, how long it's been since falls risk assessments have been completed, whether prevention plans are in place and whether they're being reviewed at a regular basis, all those sorts of things as well. Where those integrations aren't in place, or if you're using a system other than CareLineLive, or if your data is not captured within your CareLineLive tenancy in a way that's easy to map, the tools themselves are still really easy to use. So we're able to you're able to just pull up the relevant records and just answer these questions based on what you can find. I think out of the corner of my eye, we had a question there around separate logins and the like. Around cost in particular. So Jay, to answer the second part of the question, there's no sort of extra cost levied for most of the MOA functionality. It's being rolled into your renewals for your CareLineLive contracts when they're next up for renewal. I think Marie will add the particulars of exactly how that's working, but I think from April onwards, anybody whose contract's up for renewal, this will be bundled in with that.
But if people want to have it earlier than that, they just need to be in touch with us, and we can do an early contract renewal. So people don't need to wait until their contract is due for renewal.
Yes, absolutely. In terms of embedding the function within CareLineLive and maintaining separate logins, so that's a body of work that's rapidly underway at the moment. So presently, behind the scenes, these are two separate pieces of software, but the first integration pieces that we are putting together with CareLineLive are around the flowing of user data between the two systems. So while depending on how you're set up, these will still be separate applications. The plan is in the very near future for you to be able to nominate from your users of the CareLineLive system who also indicate which of those users will also require access to MOA. So although they are sort of two separate systems, you haven't got two entirely separate environments and ecosystems and management frameworks and that kind of thing that you need to maintain. So the answer to that question is kind of sort of not quite, but it is moving rapidly in that direction over the next sort of couple of months as we flesh out that side of the integration piece as well. In terms of support for that product though, and for the MOA system, MOA have our own team of support staff and other people that you're able to contact and discuss and ask questions about the system as well. So we will give you full training on how to use it. We'll be able to answer any questions you've got throughout the life of your subscription, throughout your use of the system on how it works as well. So hopefully that kind of answers some of that question. And just while I'm pausing to have a look at some of the questions as well, we've got one here around whether it's limited to just home and domiciliary care or whether it can be customized. But yes, we also work across, we have a specific program of audits where we provide the content exactly like we have here for home care. We've got that for care homes as well. We can also, for a few organizations in other jurisdictions, we've built out similar programs and custom programs for other care operations as well. So probably your best bet there is to have a chat with us about exactly what your use case would be. Happy to have a chat with you about that offline, and we can figure out what the best way forward would be. But the short answer is yes. And yeah, Deborah, just on your comment there, we've got that noted as well. I'll make sure that we follow that up with you and just figure out exactly where that's at. Thank you for bringing that to our attention. Okay, so that's the audit tools and those components and how they work. And then, of course, there's the way in which those tools are reported on, which is critically important as well. So each month, once your tools are completed, the tools, so they run on a scheduler, so the system will kind of automatically lock them at a regular cadence. You can unlock them after the fact, of course, if you need to amend any data entry errors or if time's gotten away from you and you just haven't got your audits completed, that's fine. But once those tools are locked, you're able to access your reports immediately and pull those straight out of the system. The reports are provided in a few different formats. So we can do PDF reporting, which we can get straight out of the system. Those reports are quite comprehensive and quite in-depth and probably not the sort of thing that we're particularly interested in looking at when we're going through the higher levels. But what's probably of most interest is how we handle the flow of the outcomes and the flags that we've identified from these tools into continuous improvement actions and follow-ups. So in a module that we call Link to PCI being Plan for Continuous Improvement, this screen here allows you to get a kind of a tailored list or aggregated list of all of the questions where we've identified a potential area of risk or potential non-compliance or other opportunities for improvement in those audit tools. It lists them out for you down the page, along with details about your responses, what the industry benchmarks are for those questions, and if there's any comments or things of that nature that the auditors have made as they've gone through, those are all listed for you here as well. So in this example, we're looking at a delirium audit. In our policies and procedure review, we've identified that it was more than 2 years since we reviewed a documented approach to managing delirium. We can see from the comment here that the staff member who completed that audit identified that it was last updated in 2021. So that way we can, from that point, we can go through and just link that to a new continuous improvement action. These can be as complicated or as simple as you would like, but this will give you, when we go to that form straight away, we'll get some general advice and guidance on what we should consider doing, what those plans should address, all those sorts of things. And then we work our way through, we assign those actions to individual people, and we plan out kind of what the specific steps are that we're going to take to address this issue. We also leverage AI for some of this as well. Optionally, you can turn that function on or off. But in this example where we're talking about our documented approach to managing delirium, one thing that we can leverage that AI for is to give us just some marks on the ground here. So we can ask it, it's been over 2 years since we reviewed this approach. What's the best way for addressing this in the context of a domiciliary care provider? We can ask it that question, and it'll feed us back some general suggestions and ideas that we have, or that the AI is able to generate for, what that particular approach should look like. There's a lot of safeguarding behind the scenes that we put into this as well, and a lot of priming of the AI agents that we do to make sure that the advice is based on, evidence-based practice, that it's, coming from industry standard guidelines and best practices and that sort of things. So that feeds you through all of these suggestions, which if you want can just be entered straight into your kind of to-do list or your checklist, or you can kind of tailor those further as well. But it'll help you kind of plan out what it is that you're doing and what it is that you should have in that documented approach. So those forms go in, you can fill those actions out, all those emails go through to the people that you've assigned these activities to in the system, and they'll just get the list of what it is that they need to do to address that issue. As those are kind of completed out, there'll be evaluations that you're prompted to do at the end of the process. And then there's, again, various levels of reporting that you're able to access on this as well. So if we want to look at, say the years to date or the year to date for our continuous improvement actions, we can do that very easily through the system as well. So all of those activities that are logged, again, this is particularly useful from board and governance perspectives, but also for CQC. We can take a look through what we've done over the past year. So in each month, how many actions were created, how many had become overdue in those months as well, those sorts of things. We can look at how those actions are mapped against the individual quality statements or for the CIW standards. We can also take a look at other groupings, and we can look at some performance around those actions as well. So gives you, how many of these are associated with each quality statement, what is our time taken, what priorities have we linked with these, all that type of stuff as well. And then we can drill down into that in more detail. So we can see that, 40-something% of the actions we've logged here were for quality statement 2. Then we can get a kind of summarized list of what those actions were and look at those in more detail. Got a question there around the CQC quality statements, whether that will be reviewed to align with the impending changes. So the answer is yes. We already went through that process a couple of years ago when the previous set of CLOEs were phased out for the single assessment framework. And we are going through that same process again at the moment. Behind the scenes, our team are working to realign the audit content and all the other frameworks to map those new standards as they come in. A really powerful part of that will be that we can do retrospective mapping of the stuff you've got. So if you've got self-assessment data in here, or if you've got continuous improvement actions logged in here against the current assessment framework, that will all get migrated across to the new, the CLOEs or the CLOE 2.0 or whatever it is exactly that's going to be introduced, but all the existing content gets mapped across to that automatically. So even if you've got stuff here under the outgoing framework, it'll still be relevant from, I think it's October, they're talking about having that start to be introduced. So that's all handled for you fully automatically by our team. And then aside from these reporting tools, we've got reporting, of course, on our performance as well. So as we mentioned before, we've got various different ways that we can look at the results for individual audits and the things that have been flagged on those audits. But then we roll that up into aggregated performance against the standard. So again, for the single assessment framework, that's how this is currently mapped. When the new CLOEs or outcomes and criteria are introduced, this will be realigned for that. But this tells us that, based on, we're looking at so last year's audits, based on all of that auditing data we've done over the course of the year, this is what our performance is like against each of those quality statements and how it stacks up again against those industry benchmarks. And then we can drill down into those and have a bit more of a look at the individual characteristics and requirements for each of those quality statements and how we're performing on those. And we can look at the individual audits that have been completed that are relevant to this standard, how heavily they're weighted in this result, and what our performance has been like on those and where there were areas of risk. So, learning from from incidents audit. Here we've got a risk flag on that. So we could pull that up and have a look at those flags and look at what the improvement actions are that are logged for that as well. And then for providers that are operating across multiple locations or larger providers, we've also got a range of quite powerful web reporting tools that allow you to get some roll-up summaries. So if you've got, as we said before, different counties, for example, that you're operating in, or different CQC locations, you can get some comparative results of your kind of compliance ratings and performance across all of those areas as well. So we can look at, a cluster of 5 service locations, look across 3 audits that we've run in a particular month, see if any locations are underperforming or if any audits are consistently problematic across the group. We also provide risk ratings and risk theme analysis and things of that nature at this level as well. So for smaller providers and for standalones, this reporting tool is probably not something that you'd spend a lot of time with, but particularly for the larger guys, this is really powerful in terms of identifying, if you've got a trend that's appearing in your data and in your flags, is that something that's specific to a particular location, or is this a structural organizational issue that we need to address at a corporate head office level, things of that nature. So that's probably all that we're really going to spend a huge amount of time diving into today. As I mentioned, we do have some other additional modules within MOA around accident and incident management and feedback and complaints management and risk management as well. Those are ancillary tools. They are a small additional cost, but we can look at those with anybody who's interested at a later date. But all the stuff we've looked at today is what's included in that CareLineLive package for contracts that are being renewed at the moment. And as I mentioned, if you've got other service streams within your organizations that aren't using CareLineLive, so particularly care homes or other types of care, social care provision, we have offerings that are the same as this in those other domains as well. So we're very happy to talk about that too. MOA, incidentally, Jade, just to answer that question, back in the day when we first got our start, we went by the name Moving On Audits. We got rid of that about 10 or 15 years ago now, mostly because we've got an awful lot more strings to our bow than just audits these days. And also one of the directors of the company tells the story that once upon a time, somebody told us that the phrase moving on when we're in the aged care space in particular has some implications that are sometimes best avoided. So we've got rid of that. We got rid of that moniker, but we've kept a nod to it in the branding.
It's probably worth mentioning, because people that have followed our emails for a few years may remember that we used to talk about a company called Linear that did benchmarking. Same thing. You actually launched in the UK initially as Linear, didn't you? And then changed it to MOA.
Yeah, that's right. Yes. So the elements of the solution that are included in the CareLineLive integration are everything that we've looked at today. So the included in the product and in the things that are contracted in. So all of the audits and all the tools that come with that, the reporting, the continuous improvement planning, all of that, everything that we've looked at today is included in the CareLineLive contracts. In terms of, just for the avoidance of doubt, with the integration specifically, when we're talking about that in the technical product context, as in what data is integrated between the two, at the moment, the things that we're starting with are user access and lists of clients as well. So when we're doing things like surveying and random sampling in the audits, one of the early pieces that we're launching as part of that integration will be around getting the lists of your clients from CareLineLive and populating those into MOA, so you've got rapid access to those for surveying and for auditing and care plan reviews and those checklists in these tools as well. So yeah, those are the things that are included with CareLineLive.
Thank you very much, Dave. So we'll just leave the call open for a bit to see whether anybody else has got any other questions. We've had a few emails as well as messages from people that are interested in getting involved with MOA, getting MOA on board. So let me just share this screen. So if no bad thing to just go to the link, which is the CareLineLive demo link there, and you'll see a little form and you can request a demo, and that will actually, there's then a drop down and you can say specifically that you want to look at MOA or CareLineLive or both or whatever. But if you know you want to talk to MOA, just select that link, and then Dave or Aisha will be in touch to set a call up with you. If you are a CareLineLive customer and you are interested, please get in touch with us. You can do that through the support team or through our sales team. If you're currently in contracts, we can talk to you about how it works in terms of bringing forward your renewal so that you are in your new contract period and you can have MOA rolled out as part of that. So all fairly straightforward. We do have a couple of pages, 3 pages actually, on the CareLineLive website now that's all about MOA. So it does sort of explain what you can get as part of that offering with CareLineLive, but there are these additional modules as well that you can buy into. The best thing really is to just get why am I stammering here? Is to get a demo booked. You don't pay. So Caroline, to answer that question, if you're not with CareLineLive, you would have a separate contract with MOA that will give you access to MOA. If you're with CareLineLive, it's part of your subscription package, and that will be if you're a brand new customer to us, it will automatically be included. If you're an existing customer, that will be rolled into your package when you renew, or if you request to renew early. So I hope that's clear. Any other questions? Okay, well, I think we will close it there. I will send you a link to the recording of this, and also a link to the PowerPoint slides and everything. Thank you ever so much for joining us. I'm going to close the meeting now, and we hope to see you at another webinar soon. Thanks very much.
Thanks,
Thank you
everyone.
as well,
it's been a
Katie.
pleasure.
Thank you so much for taking part.
Thanks very much for having me.